Good evening, everyone. Hope you're doing okay.
Joy. Yes, there she is.
Hi,
Hello, how are you?
I'm good, thanks, Sarah. How are you?
I'm okay. I'm a little bit croaky, so I apologise for my slightly lower voice today.
I
But
can do a lower voice as
I'm on the other side of the screen today. Um, so thank you so much for joining.
well.
I
That's all
think
right.
it's an interesting follow-on from our previous discussion, and I think I remember you making you commented on how little education was provided as part of your training
Yeah,
in terms of exercise and the benefits of exercise for people living with and beyond cancer.
yeah,
um, so I kind of wanted to build on that discussion a little bit more today, and as much as kind of proactivity as we can provide for to support patients
yeah.
who
It's
want
really
to
important.
exercise during their cancer, but also how we can work with healthcare professionals to support their understanding a little bit more around the benefits of exercise, and so that they can support their patients in promoting and providing the right advice that they need.
Yeah, we have a lot to
Um,
do.
We do. I do. And I'm not suggesting that we're doing it all, but I know there is already a lot of stuff going on. And I'm not saying that there is no advice out there and people aren't being recommended exercise, but I think it's something that has a lot of evidence now that should be included within the cancer care pathway.
Yeah,
And there are some brilliant organisations out there who are starting to push that and doing studies to make sure that it does become part of that pathway. But kind of based on your experience,
yeah.
how much advice do you think is provided to patients when they're going, like even before they even start their treatment, when it comes to exercise?
So if I go back to 2015, that isn't that long ago, when I was diagnosed myself, I never spoke to a patient about exercise, ever. And I'd
Okay.
never heard a boss or a colleague talk to a patient about exercise. And I only mentioned it if a patient brought it up. Will this surgery affect me playing tennis? Oh, let me think, I don't know. And my opinion was based on what I thought was common sense, based on my own knowledge of that sport, which can be very, very little. I don't remember ever having a lecture on it at medical school. I think in the last couple of years, things are changing and doctors are becoming more aware, but we get maybe 3 or 4 days a year to go to conferences to refresh our knowledge on what is going on. And if you're a
Mhm.
surgeon, you want to spend that time going to a surgical conference, finding out what the latest things are. You don't necessarily have time to waste to learn about exercise or nutrition. So it's how you get that information to people who don't know they need to know it.
Yeah, I think that's key. I see a lot of people who come to me who know that they need to exercise, but they don't know how to go about it. But there's also a whole lot of people out there that don't even know the benefits that it could be providing them to prepare for their treatment, to then manage some
Exactly.
of the side effects through their treatment, and then to recover from their treatment.
And I think if you've never had cancer, you have no idea what a cancer patient is capable of during and after treatment. And that fear of saying something that makes them hurt themselves, that could come back to you in the future, it's really hard. It's hard enough telling someone fit and healthy to exercise, but you haven't had chemo yourself. You can't imagine anyone exercising through chemo because you haven't had it. That makes it even harder to give advice and it's easy to say, oh, I don't know, and not mention it, which we need to break through.
Yeah. And I think there is a slight shift now happening in
Mm,
the understanding. It is improving. Since our last discussion, there's a fantastic physiotherapy network that I've had the opportunity to join, and I'm hearing some amazing studies that are happening across the
that's
UK.
fantastic.
to help people prepare for their radiotherapy, particularly in breast cancer. So
Wow.
having to sit on a table that long,
Yeah.
I see lots of women who don't get that kind of preparation from an exercise point of view to be able to hold themselves in that position and have the mobility in their upper limbs to be able to sit like that. So it's really good that there is some research happening to support patients in
And
preparation.
it's so important. So I didn't realize, and I'm a breast cancer surgeon, I didn't realize you had to have both arms above your head. Some people do for radiotherapy. I didn't get that's why the shoulder exercises are so important. And I had a stiff shoulder. I couldn't do it. And that delayed my radiotherapy by 3 months until I could get
Oh,
my arm
wow.
above my head.
Yeah.
And if I'd known from the beginning, and if there were physiotherapists who said, right, okay, we can treat your cording, we can do this, it'd have a huge impact. But again,
Yeah.
if you haven't seen the treatment, you don't know what's needed, you don't get that information.
Yeah. Yeah. And that's so true. And I think that's why you've got such an amazing insight into the world of a patient and a healthcare professional, because you've seen both sides.
Yeah.
And I mean, one thing that I get a lot of questions about is around strength and resistance training.
Yeah.
So that's something that people can use to strengthen and build their muscles. So it's outside of the kind of cardiovascular, more walking, biking, something that gets your heart rate up. This is exercises that you probably see as, you know, more weight training with weights, or you can use your body weight. I think for me, that is where the kind of understanding or the lack of knowledge is struggling, because people are told not even to lift a kettle, particularly in breast cancer,
Yes.
after surgery. And so the thought of lifting a weight is just very scary.
And the old wives' tale of you shouldn't lift anything with your breast cancer arm, you shouldn't lift weights, you shouldn't exercise it. It's all bullshit. We now know that exercise reduces the risk of lymphedema. And I think a lot of people are scared of going to the gym. You know, it's a scary place, men on steroids grunting away. I don't know what someone should do. And should you lift, like, it's not safe to lift heavy. What if I hurt myself? And again, it's that fear of, well, I won't do anything. But it is almost more important than the aerobic exercise.
Yeah. And that's what the studies are now showing, is that together, particularly, they're having such a huge benefit on fatigue, cancer-related fatigue, a lot of the side effects through chemotherapy. But one thing you did mention is the lymphedema risk, and I think that's where the fear lies. Is you know, there is a massive fear around lymphedema, and it is about progressing that weight training slowly to build back up to something that you perhaps could lift before. And that's never saying that you can't do it. And that's why I don't want anyone to ever be told that they can't do X, Y, and Z. But it's just about being a little bit more cautious and treating your kind of cancer body a little bit differently to your pre-cancer self.
Exactly. And if you worked out before, I had to get over myself, because I had been in the gym before, and suddenly on my weak side, I could barely lift a kilogram weight. The smallest dumbbell in the gym was too heavy for me to do 10 shoulder presses. But I started with that weight and I slowly built up, and it's kind of to work both equally. But my shoulder stiffness went after 6 months of lifting weights, because I was using it properly, and it's so important.
Yeah. I mean, I've seen a lady who couldn't get her hands, she's in her 40s, and she couldn't get her hands above her head. And she'd had a frozen shoulder pre-cancer, but unfortunately it'd been the same side she was affected by. And the orthopedic surgeon had given her physiotherapy, and they'd kind of said to her, that's it, that's as far as you can get. Within 8 weeks of lifting weights, she had both hands above her head with weight in it. She was still struggled, but she did get there. And I think it would just be so beneficial to so many people's quality of life, because of, you know, this younger generation of people being diagnosed with cancer. They shouldn't have to suffer not being able to lift their hands above their head, or, you know, getting out of bed in the morning and really struggling to move or get up and down the stairs. Young women in their 30s, 40s, 50s, 60s who can't walk up the stairs. It makes me cross. And just with a little bit of strength training, they could get there.
And it could all be done from home with a resistance band and a couple of small dumbbells. And for me, looking in the mirror, seeing me doing it, thinking, oh, I'm getting better. You see that progress, you feel stronger. And it's It's bone strength as well, because we know the
Yeah,
menopausal treatments weaken your bones. You're at risk of getting weak bones and breaking your hip and your ankle. And for metastatic cancer patients, it's just as important for strengthening the bones and the muscles around them. But I think doctors
yeah,
are so scared to tell you to exercise because most of us don't do it ourselves. We don't get how good
that,
it can make you feel, and how often,
yeah,
I don't know whether when you're exercising, I forget about everything else going on. I'm just
yeah,
Liz. I'm not a
yeah,
cancer patient. This is my time. And that again is a huge mental lift.
yeah. Definitely. I mean, that was my savior from cancer was exercise. And I mean, I know you go to the gym. I work out mainly outside with
Mm-hmm.
patients because I feel like taking them away from that kind of clinical environment or the fear of the gym is quite beneficial for their mental health as well.
Yeah.
I think if you know what you're doing in the gym, you can get there and you can kind of gradually get back to where
Yeah.
you were before. But finding these kind of amazing little spaces definitely works for some of
Kind
the
of,
people that I work with.
you just need a
Um,
park bench and a tree, and it means you can do it anywhere.
exactly.
You can do it at home, you can do it in a hotel room, you're watching telly, you can do tricep dips on your chair. You don't need to be in a gym.
And it doesn't take very much time, strength training. So, you can do a kind of 20-minute maximum routine and get through a large proportion of your body, or do a lower body 20-minute routine and then do your upper
Yeah.
body the next day. But starting to introduce that kind of basic strength training a couple of times a week can be massively beneficial in
Yeah.
terms of building the support that your joints and the bone density and everything that your body needs, particularly for women and men actually who have had hormonal therapy,
Yeah.
where everything becomes a little bit weaker. And then, to support your heart as well, you can get out and walk every day. I see you on your Instagram going out walking the dog, and it's just doing something. You can feel it as part of your day, just to
Yeah.
help keep your heart rate up, keep your steps up, keep your mental health all nice and kind of tuned
Exactly.
in.
And I think a lot of people think yoga and Pilates, do they count? And unless you're getting really hot and sweaty, they don't. That's an extra on top of the cardio exercise. And when I'm walking, if that's the only exercise I'm doing that day, I will kind of sprint walk. I'll do an interval where I'm getting my heart rate up and I can only talk in a couple of sentences. You're meant to push yourself to feel a little bit uncomfortable to get that
Hmm.
heart rate up, to get the benefits. A gentle plodding walk is a fine basis, but to see the benefits, you do need to push yourself.
Yeah. Yeah, and definitely progressing that nice, every day a little bit more time or a little bit more distance. But
Exactly.
allowing, that kind of yoga and Pilates can be an option for a strength and resistance as well.
Oh,
There
completely.
are versions of it where you can, particularly with Pilates, strengthening the core.
Yeah.
There's a brilliant lady who works in bowel cancer and stoma recovery, and she does a lot of Pilates
Well,
work to
she's brilliant,
strengthen
isn't she?
the cores.
And
Yeah.
again, things like downward dogs and things where you are supporting your own body weight when you're doing the sun salutations, that does kind of count. And power yoga, again, when you are
Hmm.
actually having a proper workout, they're brilliant. It's
Yeah.
it's supporting your body weight. And for me, it's keeping my body fit to cope with whatever happens in the future.
Yeah. I saw a brilliant quote the other day about I don't train for a bikini body. I train for my old granny body so that I can feel that
I
actually
love
when I'm
that.
older, yeah,
I want to be
I'm
bungee
going to be
jumping
in
when I'm
brilliant
80.
shape.
Yeah. There's an
Brilliant.
amazing woman in her 70s who's got into the
Oh,
gym and
Joan.
training. Yeah, she's incredible. This woman in her
I know.
bikini with super fit.
Yeah, and it's never
And
too late. I think that's
no,
a good message. It's
it's
never too late. If you
not.
didn't exercise through your treatment, it doesn't matter. You can still start now. Um, and kind of going back to some of those barriers that we talked about patients
Yeah,
facing, I think the main thing that comes is the confusion of how different types of information and different types of people are giving that information, and particularly when I'm saying one thing, for example, and then their oncologist is saying something different.
yeah.
That's when it becomes a little bit more difficult,
Who do you
because
believe?
exactly. So just kind of liaising closely with the oncology team to make sure that they're happy with an exercise program. There was somebody that I worked with who had a form of leukemia, and I just spoke to his physio and his oncology team, and we agreed what he was going to do before we even started.
Yeah,
And that became quite a nice way of of working together in a partnership, and then they felt more confident that I knew what I was doing. They knew exactly how I would be working with him. And I think part of it at the moment, particularly where the healthcare professionals aren't necessarily proactively pushing exercise quite as much as we want them to be, it's about you taking a proactive lead in doing that,
Yeah.
and then working with whoever it is that you're working with to come together with a plan that your oncologist and the rest of your team
Yeah.
is happy with.
And then you
And
are
then
educating them as well. So think,
exactly.
oh, this guy or girl with leukemia can do this during chemo. Oh, okay. I'll remember that
Yeah.
and think about the next one. And I think
Yeah.
this is a time where the doctors often don't know best. We don't have that information. We don't know. We are going on what we think is common sense or what we think we might like to do. And it's really hard as a professional to say, I've got no idea about exercise. But you don't know who to go to, because you may have
Yeah.
a physiotherapist in the hospital you never met that's just basic stretching and rehab. How do you find an exercise trained PT or physio to send your patients to? And I think that's the hard bit, when you don't know where the gap is.
Yeah. And I think it tends to be with a lot of people who have done exercise pre-cancer. This is the kind of person that I tend to see, who is really keen to keep exercising or wanting to get back to exercise as quickly as they can after the treatment. And they've done the physio, they've done all the kind of like immediate rehab, and they're like, what now? Because I want to do more than that walk to the shop. So those are the people where they hit that barrier with their oncologist or with their oncology team, and they need some more information. And that information is out there, but it's quite difficult to find. So I think making sure that you feel confident that there are studies out there, and we can share some of those studies. There are studies out there and guidelines out there that are changing to support the need for people to exercise before, during, and after their treatment.
It should almost be the first treatment. You have cancer, you are going to exercise and do aerobics and weights 2 or 3 times a week, and I'm going to treat the cancer. And this is a contract that your doctor has with you. Mm-hmm. That's what it should be. But I would say, if you are a patient who's had cancer, who exercises, who has a good PT, someone like Sarah, will you tell your team, do you know there's all this evidence about exercise? I found an incredible person who knows what they're doing. You can refer patients to them. Give us as doctors that information.
Yeah.
So we know who to refer to. Share the love inwards so we can then refer on.
Yeah, and there is a nurse who I know at the Marsden now who's doing just that.
Brilliant.
But it is about creating that network and making sure the patients are giving the feedback as much as us pestering them as well.
Because doctors don't have time to find out all these people, but patients do, because we're stuck at home thinking, right. So share that information back with the team and say, right, did you know you're meant to exercise? Let me tell you the latest research. Here you are. Here's someone you can send your patients to.
Yeah. One thing that I do find quite interesting, though, actually, and I looked into this about 2 years ago, just after I'd started, and I phoned up Bupa to find out whether insurance companies funded exercise professionals like me, and they said they didn't. So I think that's quite an interesting opportunity, shall we say, to try and support people in terms of funding, because money is going to be an issue at some point.
A lot of people can't work, you work part-time, you lose your job, and it's hard to pay for a PT. And I think we need to get if you have private healthcare, get them on board to help fund it.
Yeah, I think so. That's some conversations that I've definitely started having. And just so you know, there are to everybody out there are some opportunities for free support provided by the Macmillan, the Maggie Centres, for example, Safe Fit, which is run by the Can Rehab Trust. They are running a free virtual exercise programme, which in itself is a study. So hopefully, given that, they're going to support the change in this kind of care pathway. Another charity actually started really recently, run by a lady who had cancer herself, called the Fitness Support Network.
Well, I've not heard of them. I'll look them up.
They are actually funding people's gym memberships to swimming pools, things like that, within your first year of diagnosis. So you can go to them and they will seek funding to support you to exercise within that first year. And there are quite a lot of charities out there like Trekstock and Move who support the kind of slightly younger generation. And it's what I'm finding, a lot of people that come to me is the kind of mid, like 30s to 60,
Yeah,
where they were fit before cancer and they want to do more
yeah.
than they feel is perhaps too basic or not quite enough. And obviously not to put down any of the programs that are out there already,
But I
but
want to
they
run a
want to live.
marathon. I don't want to do
Yeah,
bicep curls. I want to, and often people do get fitter and do more crazy sporting challenges after cancer because they realize I can train and this is fun and I can get fit. Instead
yeah,
of saying, oh, bless, just sit in the gym on a recumbent bike, that'll do you. No.
yeah, exactly. And actually they're more determined than ever to do that now because
Yeah.
they know how it's going to support them. um and even some of the big cancer bodies are starting to change their guidelines now. So
Yeah.
ASCO, the American Society of Clinical Oncology, they changed their latest guidance to say that exercise should be recommended during active treatment. So
Yeah.
whilst you're having some of your chemo, radiotherapy, immunotherapy, because the evidence is so strong, they've gone back and reviewed all the studies. They've made sure that they've got so much data in a good patient population,
Yeah.
and they're saying it's safe to do it, particularly for those who are going through treatment for curative purposes.
Yeah.
There is more research coming out for those coming in kind of stage 4, particularly with bone mets, but the research is there to support the exercise
Yeah.
and that it has been beneficial.
And we can put a
So
link to that paper. So someone's just asking the questions. I've got cancer. I want to exercise. Who do I ask for help? GP, surgeon, oncologist? Do I find a random physiotherapist? Where do you go to find out what is safe to do and how to get started?
really good question. My first port of call would be the Can Rehab Trust.
Yeah.
So they are an organisation who train professionals like me, cancer and exercise specialists, but they're also the team that are running the Safe Fit trial. So they have a big registry of people like me, and they can put you in touch with somebody who is local. So that's the Can Rehab Trust.
They're brilliant. And again, they know if you've got a colostomy, then you might not be able to do a wood shop, but you could do this exercise. They know how to train people with cancer and how to train them properly. So it's a fantastic place to start. Your GP is unlikely to have a clue. They may know you
Yeah,
should exercise, but they won't tell you what to do. The same with your doctor, your nurse, or your team, unless you're very, very lucky. And I think Can Rehab, or asking someone like, Sarah, or the various trained people that you find online to say, right, who can I go to?
yeah. If you search cancer and exercise specialist, I would hope that a few people
Yeah.
would come up. And they can support you. They've had the specific training, and they can help you through a program. And someone else has commented about their lymphedema and said, if they don't use gentle weight training, then the fluid pressure and discomfort return.
Yeah.
So exercise is actually the best therapy for it. So I
And the
think,
sad thing is, it's free. You can do it at home. It gives you control. We should all be doing it, but it can be hard when you're knackered and you've put on weight and you're going through treatment and you just can't be bothered. It's really hard to get motivated at times. Have you got any tips for patients to get motivated to start and carry on, Sarah? Because I struggle with it at times.
I think we all do, and that's okay. And I think it's just not giving up when you have one of those days. So if you have a bad day, then we write it off and then
Or
we
week
move on.
or month. I've had a couple of
Okay.
months where I've done
We
very
try,
little.
we try and get back to a bit of a routine, and it's planning. Annoyingly, it is planning. If you've
Yeah.
got a lot of stuff going on, and I know you've been away, it's just trying to get that routine back and getting that first workout out the door. Planning your food is really a way to help you feel a little bit more in control, and the exercise kind of then falls into place around that. So having a Sunday night, I sit down, I menu plan for the week, and then I try and slot in where I'm going to do my exercise.
I put it in my
I've been,
diary. So it's there.
yeah,
I have a date with myself to do it, and then I work the week around it.
yeah. And I struggle to exercise as well, even though I'm on my feet all day. It's hard when you've got a busy life. But I think somebody told me once is write how you felt after a workout and stick it on your fridge door. And then
Ooh.
when you don't feel like working out, just go and have a look at it. And that really helps. And also getting up in your gym gear and getting dressed in your gym gear and not getting out of it until you've done that workout.
Yeah.
Because as they say, no one ever regrets a workout.
The first
So
10 minutes, you think I'll do 5-10 minutes and then I'll stop, but you never stop, you carry on.
no, you carry on,
And
and doing
another,
it. Sorry, go ahead,
no,
Liz.
go on, Sarah.
I was just going to say, like, doing it with somebody else as well can motivate you, so you can't let them down. Meet somebody else for a walk or a run or a workout, and then it becomes a little bit easier because you've got somebody else there.
So someone said, can't you just train as you did before, just a little more gently?
It depends. It depends what kind of treatment you've had,
Yeah.
really. So I would just seek a little bit of support first. Check that they're happy that what you were doing before is suitable for your post-cancer self, and then you can adapt the program accordingly. But it's just understanding you kind of what you can and can't do. And I did have a question around, what are the specifics that anyone exercising after a cancer diagnosis needs to be aware of?
Yeah.
And it's quite a general blanket question. And this is going to be different for everyone. There is no one size fits all, unfortunately. We do work on quite personalised programs. But things that you should be aware of is your risk of lymphedema. So that's if you've had any lymph nodes taken from your groin, for example, from under your arms, if you've had any radiotherapy to your lymph nodes, or if you have a high BMI, that puts you at a higher risk of lymphedema. So when you have a higher risk of lymphedema, you need to be a little bit more cautious with how quickly you progress your weights.
Yeah.
So you need to take your time and see how your body responds to a certain weight for a couple of attempts, so maybe a couple of weeks to see what it does, and then you can start to increase, but do it gradually. And the same goes for everyday things. So picking up heavy shopping bags, just be a little bit careful how heavy they are until you know you can lift that weight in the gym. And that kind of goes back to competing with your pre-cancer self. Just wipe that slate.
That's what I found really, really hard. I was looking at, I just got into triathlons, I was cycling, and I did no sport at school. I only got into sport in my late 30s. And I had to stop comparing myself and realize my body has changed. I realized that my heart rate had changed with chemotherapy. So I used to train by heart rate zones, and my heart rate was very, very different. And I couldn't rely on that. And I had to go back to how hard am I breathing and stop looking at the numbers. So if you're a serious athlete, you may find that your zones have changed completely. I realized that it takes me much longer to recover from a hard session. So I may do a 3-hour bike ride. I would need 3 days off rather than 1, because chemotherapy can affect your immune system, everything, and it takes time, and it's giving yourself time to recover and add in more rest days and learn what works for you.
Yeah, really, really good advice.
You have to listen to your body, and remember, it can take a year to recover from chemotherapy, and it can biologically age you by 10 years. So it is taking that time to build it up slowly. So someone asked, how is our fitness compared to how we were before? I am fitter and faster and stronger than I was before I was diagnosed at 40.
Yeah.
How about you?
I probably was about 6 months ago.
But it's you can get your fitness back, and you can be fitter and faster and stronger. There's no reason why, because after primary cancer treatment, you don't have cancer. You are at a risk of it coming back, and you're living with the side effects, but there's no reason why you can't do anything.
Yeah, I mean, I'm definitely stronger. Cardiovascular, a bit like you, I notice my heart rate it gets higher faster, and I hit almost a wall quicker, so I can't push quite for a longer time in that top zone. So running, not so good. But yeah, weightlifting, definitely stronger than ever before. Body is very different as well.
And the weightlifting is the key to lose weight, especially after the menopause. I didn't eat protein for breakfast and lunch. I lived off bagels and cereal, but actually by having protein at every meal and weightlifting, I suddenly lost the extra fat I put on during the menopausal treatment. And it's a fantastic thing to help with the weight gain that so many people struggle with, wouldn't you say?
Yeah. And kind of metabolism, it increases
muscle
all of that.
Burns more calories than fat as well, doesn't it? So you're just ramping everything up.
Exactly. And your whole body is moving. So even though you might not see your heart rate go up to a high level that you do when you're doing cardiovascular activity, which is, these Fitbits and
Yeah,
Fit watches rely on that. They tell you you've only burnt 100 calories. That's relying on your heart rate. It's not necessarily
no,
going to tell you the truth about what that strength training is doing for your body. So don't rely on these too much for your the results from your strength
yeah,
training. Right. So I obviously I don't at all want to put down the work that the NHS are doing, and I think they are doing a fantastic job, and they're massively firefighting at the moment, trying to catch up with a lot of the pandemic
yeah.
backlog. So how can we support people? I mean, I love working to support charities. I love doing things like this to raise awareness. But what is it that you guys need to help you understand a little bit more about how to exercise safely after that cancer diagnosis? Because that's kind of what I'd really like to help people with, is to
Yeah,
arm people with the right tools. And I think things like the right information and the right studies, which is kind of what you're doing, Liz, from all different aspects of breast cancer, really help people understand things clearly and simply. And I think the same needs to be done for exercise, if you agree.
definitely. And I think we could just put a video or a reel out there saying, what information do you want? What were you told? What do you want to be told? So if everyone watching can send that back to us, we can then use that to go back to doctors and nurses and say, look, this is what's important. I think patient power is incredible. It's amazing when patients get together, you can change things. And I think if you all say, right, I'm exercising, what are you doing? This woman's a crazy, this is the book I'm using, share what you are doing, the doctors will realize they have to get on board. And it's kind of creating that momentum of everyone saying, I'm doing it, I know I need to, I'm going to halve my risk of recurrence. This is the thing. I give chemotherapy if there's a 5% benefit based on trial data, which means that 5 in 100 women will live longer because of the chemo. The other 95 won't. And I don't know if you're in the 5 or the 95. 5% benefit to help you live longer. Exercise, 50% benefit for some of the major cancers like breast and bowel. That's incredible.
I know,
This is
it's so
why
cool.
it's so important. And that's not just breast, it's bowel, it's prostate, it's colon, it's lung. Just to go back to chemotherapy aging, it biologically ages you. But exercise can help reverse that. By looking after yourself and eating healthy, you can reverse those effects. But some things like the effect on your ovaries, they will stay aged by 10 years. But it does change the makeup of the body.
Yeah,
But let's do a
definitely.
video asking people, getting you to tell us what information you want.
Yeah, definitely. And any support that we can provide to make you feel safe and in the gym or wherever you want to exercise, we want to be able to support people to exercise more. And as Liz said, going to your doctor, telling them about the experience that you've had or the information you've got, is really important to help them and educate them a little bit more, so that they then can tell the next patient to do the same. So the more we spread the word, hopefully the more people we can get on board from all of the different kind of elements of the oncology team that you cross through your cancer experience.
I think someone's just asked, why isn't every cancer? That's because we haven't done the research yet. It's very easy to get a lot of breast cancer patients together to do a study. It's hard to get a lot of anal cancer patients together, but I think the benefit is there. Another thing I was going to say briefly is just to mention kind of books and podcasts and websites. I'm sure you know them, but can I just put 2 books up, Sarah?
Yeah, I've got them here too.
You've got them here too. So the first one this is backwards, but we'll put the details up. Carolyn Garrett, Get Your Oomph Back After Cancer. She's had cancer. She's a PT. She has the evidence in here. She tells you what to do at home for free with resistance bands. Plus there is wheelchair cardio, because some of you can't stand up. So if you can't get out of a chair, there's stuff in here that you can do to get your heart rate going and resistance bands. And you can take that to your GP and your breast surgeon and say, have you read this? You should have a copy in your waiting room for patients to read. Another book by an incredible professor who is the woman behind almost all the exercise evidence out there is by Professor Katie Schmitz, Moving Through Cancer. The website is Moving Through Cancer. Katie has all the evidence. She's written half of
Yeah.
it about why you need to do it. And again, stuff from home with resistance bands.
Yeah. And actually, Dr. Schmitz is she has an amazing log on her website where you can download it and track your lifting,
Your sleep,
moving,
your
sleep,
food.
protein.
And
yeah.
she's been there. Her wife has had head and neck cancer. Her wife had her nose removed. So she's
Yeah.
learned firsthand how to look after someone and how hard it is to get someone moving. I know it's upside down. We'll put the links in the notes. And we can also put the video on YouTube so we can share it off Instagram as well, because we need to get everybody exercising.
Definitely. And whatever we can do to support that, then please do let us know. We'll stick that video up. But that feels like a very good point for us to close.
I think so.
Liz, thank you so much for coming to talk to me today.
No, and, thank you. Again, if you guys want us to do more, you have more questions, we're happy to keep doing this, just banging the message, share it. Share this video with people, share the accounts of people like us with people, and let's just get this, let's get an energy train going.
Yeah, definitely.
Hold each other to account. Say on your
a
stories,
moving train.
I did my weights today. What are you doing? Add yours. Let's just make this a daily part of life.
Yeah, definitely. Thank you very much, Liz.
No,
and I will speak to you soon. Thanks everyone for watching. Give us a shout if you've got any other questions.
Bye.
Bye.